Over 50? There is an island in southern Japan where people routinely live past 100. And one of their oldest daily habits has nothing to do with diet, supplements, or even exercise in the way you might think. It is something far simpler. They breathe differently than you do. Specifically, they practice 4 breathing patterns that researchers now believe play a direct role in lowering blood pressure, calming the nervous system, and protecting the brain as you age. And the science backing these techniques is not alternative medicine or guesswork. These are peer-reviewed clinical findings. So if you have ever felt like your stress levels, your sleep, or your blood pressure numbers are slowly getting away from you, this might be the most practical thing you hear all week. The island is Okinawa, a chain of about 160 islands at the southern tip of Japan. Okinawa is one of the 5 original blue zones, places where people consistently live longer, healthier lives than anywhere else on the planet. The Okinawa Centenarian Study, which has been running since 1976, has tracked more than 1,000 centenarians across a population of just 1.37 million people. That ratio is extraordinary. Researchers from that study found that Okinawans have significantly less cancer, less heart disease, and less dementia than Americans. Women there live longer than any women on Earth, according to National Geographic longevity researcher Dan Buettner. And while diet and social connection get most of the attention, what often gets overlooked is the role that controlled breathing plays in the daily life of Okinawan elders. Each morning across Okinawa, you can find groups of elderly residents gathering outdoors for radio taizo, a gentle routine that has been broadcast on Japanese radio since the 1920s. It airs every single morning at 6:30. And the final movement of every radio taizo session is always the same. Raise the arms, breathe in slowly and deeply, lower the arms, and breathe out completely. That deliberate full breath pattern is not decorative. It is the gateway to the 4 specific breathing techniques Okinawan elders weave into their daily lives. Number 1. Diaphragmatic breathing, or what some people call belly breathing. This is the foundation, and it is the one Okinawan elders practice most consistently throughout the day. You place one hand on your chest and one hand on your belly. Breathe in slowly through your nose for about 4 seconds, and focus on pushing your belly outward while keeping your chest still. Then exhale slowly through your mouth for about 6 seconds, letting your belly fall back naturally. That is one cycle. A 2017 study published in Frontiers in Psychology found that just 10 minutes of diaphragmatic breathing significantly reduced anxiety levels and improved attention in healthy adults. For seniors specifically, research published in the journal Medicine in 2023 showed that 4 weeks of slow breathing exercises produced measurable drops in both systolic and diastolic blood pressure, along with reduced heart rate and lower anxiety scores. The study included 64 participants with an average age in the mid-50s. The mechanism is straightforward. When you breathe deeply into your diaphragm, instead of taking shallow chest breaths, you activate what is called the parasympathetic nervous system. That is your body's built-in calm-down switch. It tells your heart to slow down, your blood vessels to relax, and your stress hormones to ease off. Okinawan elders do not treat this as a formal meditation session. They do it while gardening, while cooking, while sitting with their moai, those tight-knit social groups that Okinawa form at age 5 and keep for the rest of their lives. Number 2. Box breathing. This one follows a simple pattern that is easy to remember. Inhale through your nose for 4 seconds. Hold your breath for 4 seconds. Exhale slowly for 4 seconds. Hold again at the bottom for 4 seconds. That square rhythm is why it is called box breathing. Navy SEALs use this technique before high-pressure operations, but the reason it works for a 70-year-old in Okinawa is the same reason it works for a 30-year-old soldier. It directly stimulates the vagus nerve. Your vagus nerve is the longest cranial nerve in your body, running from your brainstem all the way down to your abdomen. When you stimulate it through slow, controlled breathing, it triggers the release of acetylcholine, a neurotransmitter that actively counters stress hormones. Research by Bremner and colleagues published in 2020 found that regular vagus nerve activation through breathing techniques lowered baseline cortisol levels by up to 23%. Cortisol is the hormone your body floods with when you are stressed. Chronically high cortisol is linked to high blood pressure, poor sleep, weight gain around the midsection, and accelerated cognitive decline. So when Okinawan elders sit on their porches in the early morning doing rhythmic breathing exercises, they are not just relaxing. They are actively lowering the chemical that ages their bodies fastest. Now, if you are finding value in this, go ahead and subscribe. There is more content like this on the channel every week. Number 3. Pursed lip breathing. This technique is especially valuable for anyone over 50 because it directly addresses one of the most common age-related changes in the lungs. As you get older, your lung tissue loses elasticity. Your airways tend to collapse a little more easily during exhalation, which means you do not fully empty your lungs with each breath. Stale air stays trapped inside. That leads to lower blood oxygen levels, more fatigue, and that frustrating feeling of being short of breath even when you are not doing anything strenuous. Pursed lip breathing fixes this. Breathe in through your nose for 2 seconds. Then pucker your lips like you are about to blow out a candle and exhale slowly through those pursed lips for 4 to 6 seconds. The slight resistance created by your pursed lips keeps your airways open longer during exhalation, allowing more stale air to escape and more fresh oxygen to reach your bloodstream on the next inhale. Pulmonologists recommend this technique for patients with COPD and chronic bronchitis, but you do not need a lung condition to benefit from it. Okinawan elders integrate this naturally. Watch them walking along the coastal paths in Naha or Ogimi village, which once had the highest concentration of centenarians on Earth, and you will notice many of them exhaling slowly through slightly pursed lips as they walk. It is a habit so ingrained that most of them probably do not even think about it anymore. The result is better oxygen saturation, less breathlessness during daily activities, and improved endurance for the kind of gentle movement that keeps their bodies functional well into their 90s. Number 4. The 4-7-8 breathing technique. This is the most structured pattern of the 4, and it is the one researchers have studied most aggressively in recent years. Breathe in quietly through your nose for 4 seconds. Hold your breath for 7 seconds. Exhale completely through your mouth for 8 seconds, making a soft whooshing sound. That is one cycle. A scoping review published in the Proceedings of the International Conference of Innovation Science in 2024 analyzed 15 clinical studies conducted between 2013 and 2024. The review found consistent evidence that the 4-7-8 technique reduces stress and anxiety, improves cardiovascular markers, including heart rate variability and blood pressure, and enhances parasympathetic activity through vagal pathways. A separate study published in Physiological Reports tested this on 43 healthy adults and found that just 3 sets of 6 cycles, about 5 minutes total, produced immediate decreases in heart rate and systolic blood pressure. The hold phase is what makes this technique particularly effective. When you hold your breath for 7 seconds, your blood oxygen and carbon dioxide levels shift in a way that amplifies the calming signal sent through the vagus nerve. It is like pressing the reset button on your nervous system. For seniors dealing with nighttime anxiety, racing thoughts before bed, or blood pressure that spikes in the evening, this is the breathing pattern to practice right before sleep. Now, you might be wondering whether breathing exercises can actually replace medication. And the honest answer is that they are not a substitute for prescribed treatment. If your doctor has you on blood pressure medication or anxiety medication, you should not stop taking it. because of a video you watched online. What the research does show, consistently, is that breathing techniques like these four work as a powerful complement to medication. The 2023 clinical trial I mentioned earlier, the one with 64 hypertensive participants, found that slow breathing exercises produced blood pressure reductions comparable to what some patients experience in the early stages of medication. The difference is that breathing has no side effects, costs nothing, and can be done anywhere. Okinawan elders figured this out generations before clinical trials caught up. They did not have fancy terminology for vagus nerve stimulation or parasympathetic activation. They just knew that starting the morning with slow, deep breaths made them feel calmer, steadier, and more capable throughout the day. They knew that the evening breathing ritual helped them sleep better. And they knew that the neighbors in their moe who breathed well and moved gently tended to outlive everyone else. The real question is not whether these techniques work. The research is clear on that. The real question is whether you will actually try one of them tomorrow morning. Pick whichever feels most natural. Diaphragmatic breathing, if you want the simplest starting point. Box breathing if you like structure. Pursed lip breathing if you have been feeling short of breath lately. Or the 4-7-8 pattern if sleep and evening anxiety are your biggest concerns. 5 minutes a day. That is all the elders of Okinawa give it. And they are still here, 100 years strong, breathing slowly on an island most of the world has never visited. If this was helpful, there are more stories like this on the channel. Subscribe and you will not miss them.